Hello, welcome to Fertile Minds. I'm Dr. Robert Watson. I'm a fertility specialist with the Queensland Fertility Group at Everton Park Northwest Hospital in Brisbane. I'd like to talk to you this evening about what tests to have while you're trying to get pregnant. Now, before you do anything, I think it's important to establish a good relationship with your GP. You'll need this when you have a family. The GP is a wonderful resource. The GP will talk to you about your general health, your diet, your exercise, your weight, your regular menstrual cycle. The GP will also be aware, I hope, of your support mechanisms, your family, your friends who will be able to carry you through this journey. There are some tests that the GP would initiate. These are generally a full blood count to check for anemia, a kidney and liver function test, blood tests for blood-borne infection, and tests to check your immunity to chickenpox and rubella. Usually, these days we check up on your how up to date you are with your vaccinations. Now, we'd like you to have the COVID vaccine without a doubt. We'd also check your immunity to the flu vaccine and make sure that you've still got that. We'd want you to start taking some folic acid. This helps the baby's spine to form. The GP might also talk to you about timing of intercourse. When's the best time frame to try in your natural cycle? Now, if you've been trying for more than 6 months and you're over 35, or more than a year and you're under 35, your GP may choose to refer you to a fertility specialist. Now, there we take a detailed history of your gynecological life. We talk about your previous menstrual cycle. We talk about infections in pregnancies, previous pregnancies, how long it's taken to fall pregnant in the past, what your natural fertility, try and gauge what your natural fertility may be. We'd also take some chromosome tests on you to make sure that you haven't got a translocation on your chromosomes, which could cause recurrent miscarriages. We'd test your partner's chromosomes also. We'd check whether you're ovulating, and we'd know this if you have a regular menstrual cycle. That's a very reassuring thing that ovulation's okay. Even if the menstrual cycle's regular, sometimes the egg quality is poor, and we can measure the egg quality by doing a newish test called the anti-Müllerian hormone. Doing a sperm test on your partner to check his sperm quality is easily done, although most blokes hate doing it. We'd consider doing tests on your fallopian tubes and looking for endometriosis. These tests involve putting some dye through the cavity of the uterus, either with you awake in the X-ray department or with ultrasound to check that the tubes are open, or doing a laparoscopy to look through the umbilicus and watch the dye flow through laparoscopically. With the laparoscopy, we could also check for endometriosis and excise that if necessary. There's a growing body of opinion that says that women, couples should be offered tests for recessive genetic conditions. Now, these are conditions which you may be completely unaware of. You and your partner may both carry a recessive gene that if those two bad genes go into your baby, you could have a very sick child. The classic condition which is recessive is cystic fibrosis. Sometimes these tests are more expensive and they're therefore there's a degree of reluctance to participate in those. But all in all, we try and gauge what your natural fertility is without any intervention. We'd balance these against the inconvenience and the costs and the expense of having tests such as laparoscopies, and we try and individualise your circumstances to make it, we want to get you pregnant efficiently and quickly without delay and without over-treating you or over-investigating. So I think it's important when you're going down this pathway to look after yourself, to talk to your friends, to talk to your doctor, to get a good relationship with your doctor, to talk to your partner. It's a team effort, and I wish you well.